Knee injuries aren't usually the first reason that someone would think to go to a chiropractor, but here at Chiropractic, we deal with a whole range of different extremity issues, not just the spine. So today we wanted to run through a couple of common things that we see with knees and what a treatment looks like here. So for those of you who haven't joined us before, I'm Dr. Rodney White, and we appreciate you stepping in and seeing what we're all about. So Dr. Braz is being a patient here for us because he has injured his knee a couple times. So we're going to run through two of the really common things we see. So a lot of people, when they have a knee issue, whether it's more of a chronic arthritis or it's a fresh knee injury, there's a muscle in the back of that knee that gets really, really spasmed, and that can pull on some of the bones there and create all sorts of lockup. So we do a couple things for that. Number one, we might get in on it and really release that as we stretch it out. And he will tell you, if he was looking up, that that can get a little bit painful in there. But the other piece we want to do with that is sometimes we have to adjust it because part of the knee joint rocks backwards, and we just come in and give it a little thrust like that, and it's really pretty simple. That one doesn't hurt at all. But a far more common issue we deal with is meniscus injuries. Now, most people know if they tear the cartilage in their knee, which is the meniscus, they think they need to get surgery. Sometimes you do. If there's a flap that tears and it's locking out your knee, absolutely, you need that surgically repaired. But most people, when they get tears in their cartilage, it actually happens chronically over time. And then when they feel pain, they didn't just tear it, the tear's been there for a while. And if you can avoid surgery, you're normally going to show even better outcomes. So there's two things we can do here. Dr. Brazza can flip over onto his back. So in one case, we want to find a meniscus or a cartilage that's not moving properly, because that's the one that's most likely to tear in the future. Or if you've got some tears and we can get that knee joint functioning better, we can get the pressure off it, and sometimes that helps people avoid surgery. So like in our hip video, the first thing we do is make sure pelvis, low back, and all of that's functioning properly, because if your weight bearing's off, it causes a huge amount of stress on the knee. But if you're someone who has a meniscus issue, there's a couple different things we'll check. So we'll take the knee through certain ranges of motion, we'll bend it up and straighten it down, and I'm turning his leg inside and outside, and I'm checking how his cartilage slides, because it's meant to glide in there. Now he actually sticks a little bit there and there's a little bit of popping. So we just come in and we put a little bit of pressure on it. I'd hold that for about 10 more seconds and then just give a little push there. It can be tender if you have a tear there, but generally it's not. Then we come out and we check the other side, and we check what's called the anterior on each side, and then the posterior there and the posterior back here. What we find is by working on all four of those spots and finding where your meniscus is sticking, instead of gliding like it should, if we can get it to glide properly again, now it won't tear. The next time you plant and twist your leg, the meniscus will move with you how it should. If you have some tearing in there, it's even more important that that cartilage moves properly so that it doesn't tear more. So if you have a knee issue or you've been concerned about what to do, feel free to reach out to us and we'd be happy to assess you. It's very easy to tell you whether A, no, we think we can help you, or B, that needs potentially surgery. You need to go and do some PT first and those kind of things. So more than happy to help out. If you are suffering like that, just go to sapicaro.com and you can see what we're all about. Thanks for your attention, and we'll see you next time.